when you're in Advantage plan, no matter what company is, you're in that company's network now. So you do have to see doctors and specialists that take those plans, and not everybody does.
Mm-hmm.
So we mentioned, going to Houston and things like that. They don't take a lot of Advantage plans, if any. I think maybe they take some now, but it's few and far between. So you do have to understand that you're going to be a little bit limited in your health care, or paying out of pocket for it. If you want to go see a certain doctor, or if your friend tells you that this doctor is the best guy at this, they may or may not take your plan. So you have to call and check on that. Not only do you have a network, but you're giving the plan the power to say no. So even on a small scale, like the doctor may want an MRI on your back, and the plan can say no, or the plan can say, well, have we done physical therapy for 6 weeks? And then let's see if his back still hurts. So they can put kind of obstacles in the way of getting things done. One story from our office, it sounds extreme, but it absolutely happened. There was a gentleman, he's in his mid-90s, healthy guy, mowed his own yard, drove his own car, lived alone, healthy as could be for his age group. He had an Advantage plan. So he went into the hospital for a heart procedure, local hospital. Heart procedure was successful, got done what they needed to do. He developed an infection very shortly after, so it kept him in ICU over there. Now, the doctor told the family, if this was a frail person coming into this, I would not have a lot of hope. I don't know that this is going to be a great outcome. But I met this man before. We had conversations. He's in great shape for his age. Cautiously optimistic is the term the doctor wanted to use, that let's keep fighting, because I think we, can't promise anything, but hopefully we can get past this infection. So, of course, the man's family is all for it. Shortly thereafter, his Advantage plan, they had a rep that worked in the hospital, came to the room and said, we've done all we're prepared to do. As of midnight, tonight or tomorrow, whatever deadline they gave, we're not paying for this anymore. So either you can cover the cost of ICU per day, which nobody can really afford, or he has to be bumped down in care to kind of more of a general care.
Yeah.
And the man ended up passing away a few days later because he was moved down. He wasn't able to stay in ICU. And he may have passed away anyway. Who knows? But the point of the story is the family and the doctor both wanted to keep him where he was, and the plan said no. So that is something that you just have to be prepared for, or know that's a possibility with certain plans. Advantage, original Medicare and a supplement, they don't have nearly the pre-authorization that Advantage plans do. So again, I don't want it to ever sound like I'm bad-mouthing the plans. I just want to set expectations with people that this has happened, this does happen, and I want you to be prepared for it.